Greetings, I'm Dr. Jung Jong-chul. I believe the most difficult complications related to implant placement with sinus lift is infection within the sinus. And if there is no appropriate treatment afterwards, then you have to remove the placed implant and the bone graft as well. And serious complications such as chronic sinusitis can result. Early detection and appropriate treatment is of utmost significance. In this lecture, I'm going to talk about how to respond to infection that can be caused after sinus lift. The contents for today. First, I'm going to look at pathogenesis of maxillary sinus infection. After sinus infection, I'm going to talk about how to manage this. Let's look at pathogenesis of maxillary sinus infection. The cause is primarily related to blockage of maxillary ostium, which is connected to the sinus and the nose. Such obstruction can lead to hypooxygenation, and this can lead to reduced function of sinus. Various secretions can result as well as infection. If middle ostium is blocked due to multiple reasons, and if no appropriate drainage is done, it can lead to sinus infection. Patients who have had sinusitis can experience it again. It can also occur due to insufficient drainage due to septal deviation or enlarged turbinate. If the patient has severe rhinitis, drainage can also be insufficient, and this can also lead to frequent sinusitis. If the patient has diabetes or has weak immune system, the sinus membrane may not work properly due to sinus membrane thickening or large cystic lesion leading to sinusitis after surgery. In the case of sinus membrane tearing, sinusitis can occur more frequently, therefore we need to pay more attention. Sinusitis can be divided into two categories. First is acute rhinosinusitis or ARS, which occurs within 4 weeks of surgery. Chronic rhinosinusitis is where it lasts for over 8 weeks. If there are more than 2 symptoms, you can suspect sinusitis. Symptoms include nasal congestion or odor coming out from the nose, suppuration from the nose, or passing through the throat. The patients also sometimes complain of pain in sinus area or headache. The patient may also have decreased sense of smell. If there are more than 2 symptoms, you can suspect sinusitis. If you look at the radiograph, in the case of ARS, there is air fluid present. The fluid fills up here. In the case of CRS, within the sinus, you can observe mucosal thickening. This is a 45-year-old male patient. In the upper left posterior area, implant was to be placed. If you look at the radiograph compared with right, on the left posterior area, there's more bone density. No symptoms of sinusitis were complained. If you look at CT, compared with the right sinus on the left, it's full of secretion. I checked the CT to have a more overall view. Middle ostium is blocked, and within the left sinus, there's mucosal thickening. we can come to a conclusion that this patient has chronic sinusitis. At times, sinusitis can occur after surgery. There can be different reasons, including bone graft infection. Second, this can occur due to bone graft material or bleeding or membrane thickening, cystic lesion, or blockage of middle ostium due to whatever reason. After surgery, bone graft was contaminated. If there's perforation of sinus membrane, there's higher possibility of bone graft becoming contaminated. It is rare, but at times it can be contaminated due to saliva during surgery, and there can be infection due to rupture of suture. Contamination of bone graft during surgery can occur due to multiple reasons, and therefore you need to pay attention as to not to perforate the sinus membrane and to do surgery in a clean site in order to minimize possibility of infection. Suture needs to be done thoroughly so that after surgery it doesn't rupture. This is done to prevent infection. At times, the infection after sinus lift can be limited within the bone graft material, or it can be more advanced as it progresses into the entire sinus. If possible, we need to detect it early so that the infection is contained within the bone graft. If appropriate treatment is provided, we can prevent it from becoming sinusitis. Let's look at the literature. The incidence of sinusitis after a sinus lift occurs more with lateral approach. When you do crestal approach, it occurs less frequently. There's different percentages related to infection. However, by providing antibiotics before surgery, you can reduce possibility of infection. If there's sinus infection, how should we manage it? After sinus graft, if there is infection, the symptoms are following. The most frequently, you can see swelling and pain in the lateral window area. If it has been infected for a long time, fistula can be formed or a suppuration can be observed. Sometimes patients can complain of foul odor in the surgical site. In general, infection after sinus lift occurs within 1 month of surgery. However, at times, it can occur 4 to 6 months later, and therefore, when you do lateral approach, you need to do regular checkup. And this is very important. I'm going to now talk about how to manage the post-op infection. Early detection and diagnosis is very important. You need to make diagnosis early and provide medication so that the patient heals. This is the most easy way to treat such condition. Early diagnosis and medication provision can lead to easy treatment. If you provide medication early on, if the patient does not respond well to antibiotics, you can change antibiotics to get more effective treatment. These are the antibiotics used when there's infection in sinus. In a lot of cases, augmentin and cephalosporin 3rd generation are used. If the patient has GI trouble with these, you can prescribe quinolone. If the patient has severe rhinitis, you can use nasal decongestant or steroid as well. This patient is 49, female patient. In the upper left area, lateral approach was taken along with bone graft and implant placement. For bone graft material, xenograft as well as allograft was used at the same time. After 2 weeks, the patient came in complaining of continued pain in the upper left area where lateral approach had been done. There is swelling as well as fluctuation. When there is operation, the soft tissue, when pressure is applied, it goes in very easily. And there was tenderness as well. It had only been 2 weeks since surgery, so antibiotics was prescribed again. This is CT. In the right sinus, it looks okay. However, on the left, the fluid is quite full here. Cephalosporin 3rd generation was used for medication, and because the patient had rhinitis, nasal decongestant was used. After 3 to 4 weeks, you could see that the symptoms were being improved. Medication was prescribed for 6 weeks. The symptoms and conditions improved with just medication, and bone graft material is becoming more stabilized. After 6 months after surgery, prosthesis was delivered. After 10 years, the implant is well maintained. Therefore, making diagnosis early and providing antibiotics early on is very important. After providing antibiotics, there are cases where healing is done nicely. However, rarely it can progress into chronic sinusitis or fistula can be formed, albeit very rarely. The patient does not heal with medication and may progress into chronic sinusitis. In this case, drainage along with medication is imperative. After bone graft, infection can exist only within bone graft. This is quite rare. This is 48-year-old male patient. In the upper right posterior area, tooth was extracted. I waited for 2 months and did lateral window approach. Implant was placed, and this is 2 weeks after. If you look at patient mouth, swelling as well as fluctuation can be observed. Upon aspiration, you can see that abscess has already formed. In this case, medication alone may not be enough. The patient did not display any sinusitis symptoms. In this case, infection was contained within the bone graft and IND was done immediately. Healing was achieved after drainage and prescription of medication. In a lot of cases, infection spreads into the maxillary sinus. And if medication alone is insufficient, you need to do drainage for effective treatment. One way to do diagnosis is to look at CT, or by doing aspiration, you can look with your very own eyes the abscess. After doing drainage, you need to always put in the drain. You need to use elastic drain. This is most important. You need to insert a elastic drain where it can be shown on X-ray and do suture. At times, when you do IND and do drainage, if the patient is not careful, the drain can go in the sinus or may fall out. And there's no way to check. Therefore, the radio-opaque area should be cut and used for draining. And we need to provide antibiotics at the same time as well. That would be the most ideal treatment. Rather than rubber drains, elastic drain should be used. This is more recommended. This patient is a 50-year-old male patient. In the upper left posterior area, lateral approach was used and implant was placed. Membrane was perforated during surgery. Resorbable membrane was used for repair. Implant was placed. This patient used to have chronic sinusitis. On April 15th, implant was placed. After 10 weeks, The patient complained of odor coming up from the nose and complained of drainage. Medication was provided immediately, however, healing was not done properly. Upon aspiration, there was abscess. Medication was prescribed. Elastic drain was inserted, drainage was done, medication was provided. This is after prosthesis delivery. Even after 7 years, the implant is well maintained. Next, I'm going to talk about cases where fistula has been formed. In other words, medication may be insufficient for healing. It can lead to chronic sinusitis and fistula can be formed. This can be observed quite frequently. If there is infection in the grafted area or the sinus, healing cannot be done with just medication. You need to do drainage along with medication. This is very effective. After 3 to 4 months, if necessary, you can do additional bone graft or provide prosthesis. Even then, in extremely rare cases, a fistula can be formed. If fistula is formed, medication alone would be insufficient. In this case, we need to provide more than just medication. If fistula is formed, you need to make incision and remove the root cause of infection. If necessary, conduct a detoxification, do bone graft, and then case can be completed. In the case of this patient, the patient received the lateral window approach in the upper right posterior area. There was infection from early on and medication was prescribed. However, 5 months after surgery, you can see fistula. As a result, the patient came to my hospital, and after incision in the area where fistula is, you can see granulation tissue. This was removed thoroughly. The sinus membrane was in sound condition. Detoxification was done, and additional bone grafting was done, as well as implant placement. And the patient was sent back to the original hospital. This is after final prosthesis was delivered. This is the X-ray image delivered to me. You can see that it functions well. This is the summary. At times, inevitably, after sinus lift, infection can occur. In this case, early diagnosis is extremely important. Early medication prescription is very important. If medication alone is insufficient, you can do IND. At times, you need to remove the source of infection. In this case, you need to wait 3 to 4 months. You need to wait until the tissue is fully healed. After that, you can do bone graft and place the implant. Albeit rare, sinus infection can occur after sinus graft. In my case, I believe early diagnosis is very important. Appropriate management is also essential to avoid serious complications. In this lecture, I talked about causes of sinusitis and ways to treat this problem. In the case of sinusitis, the patient and the dentist alike can become troubled. Early diagnosis and treatment is most essential. You can reduce serious complications in this way. This is the end of my lecture. Thank you for watching. Thank you.